There will not be a quiz at the end of this talk, but there'll be a round of applause for anyone who can figure out why the drug is named 760704. Now, what are mitochondria? Here's a West Texas oil well. The mitochondria are the powerhouses of the cell. Now, I'm on treacherous ground here because I say I'm not a biologist. Maria and I, as she said, are both journalists, but I'm not a physician the way she is. But nevertheless, I'll go back and take you back to your high school biology. The mitochondria are the organelles within a cell that process and produce the energy that every cell in the body requires. And all of the 256 types of cell in the body have many mitochondria to produce this energy. Here's an image of a mitochondria, and I think this is actually one from a liver cell. And research is now identifying that this mitochondria, these mitochondria that once were thought to have a relatively prosaic role in just pumping out energy, actually play a very significant role in all cells, including a role in initiating the programmed cell death process called apoptosis. Here's a cartoon of a mitochondrion with a variety of genetic mutations associated with specific diseases. And as Dr. Pioro pointed out so nicely, it's unlikely that in ALS, or much less any other neurodegenerative disease, that genetic factors alone account for the disease. That may be true in the rare disease such as Huntington's, but not in the disease that we're most concerned about. It's interaction between the genome and the environment that may play the initiatory role in the disease process. But in the mitochondria per se, it's clear that there are some polymorphisms or some mutations that play a role in the enabling conditions for the disease process, not just in ALS, but in Parkinson's, Friedreich's, Alzheimer's, and others. So the mitochondria, the mitochondrion, which is the singular form, is now attracting a lot of academic and private pharmaceutical research attention. Here are some images in the animal models of ALS that show not just the cell, but the mitochondrion itself with the protein aggregates that Dr. Pioro mentioned. So within the cell, the mitochondrion also is subject to that particular pathology. Now, how do we turn these ideas or these concepts about mitochondrial health, cellular energy, protein aggregation, and inflammation, and oxidative stress into a drug? Well, I have to say that the initial observation that we are trying to capitalize on came from Charlottesville, Virginia, at the University of Virginia, where there's a neuropharmacologist, neurologist named Dr. James Bennett, who was part of a group that got a drug approved for Parkinson's disease called Mirapex. Dr. Bennett is a very prominent Parkinson's investigator. In the course of getting this drug Mirapex approved for Parkinson's, it was observed that the drug seemed to have a secondary property. The primary property in Parkinson's was to promote the production of dopamine, which is deficient in Parkinson's disease. The drug is referred to, the mechanism of the drug is called dopamine agonism. It promotes the supply available in a Parkinson's patient. But the secondary activity, noticed purely through serendipity, as so many scientific discoveries can be, was that cells, neurons, seem to take longer to die in the presence of Mirapex. Well, there's one big problem with trying to use Mirapex to treat ALS, although people are experimenting with it with very low doses. This dopamine agonism activity is very potent, and to achieve the levels required for that secondary neuroprotective activity would require extremely toxic levels of Mirapex. Well, Dr. Bennett didn't give up easily on this question. And he made the observation that there was a very closely related molecule to Mirapex that might be able to be dosed much higher and achieve that neuroprotective benefit. And I will show you those molecules in a second. When you look at the panel on the right, what you see is the results that Dr. Bennett received when he began giving patients very high doses of this closely related form of Mirapex. The first cohort is lead-in. This is the rate of change per week, not per month, which is how it's usually reported, in the ALS functional rating scale with which you're all familiar, in a period in which people were not taking the drug. He then began administering a 30 milligram regimen to the same group of patients and kept them at that dose for a particular period of time. I believe it was 3 months, a minimum of 3 months. And you can see that the rate of progression on ALS-FRS is somewhat reduced. When the dose was increased, doubled again to 60, there's a further reduction, and then at 120, yet a further reduction. And what's notable is that as the dose increases, you also see subjects who are reversing their rate of decline. Now, let's have the caveats. Dr. Pioro mentioned the lithium study in Italy, which, while very exciting, was an extremely limited study and has not ruled out the chance that it could be the result of accident. This particular study is not a placebo-controlled study. It does not have a sufficient number of patients to demonstrate statistical significance. Nevertheless, there is a trend that's hard to miss. And when we, Canop, the little biomarker company in Pittsburgh, found out about this work and recognized the significance of this unmet need, we went down to Virginia, pulled all the money together that we could, and licensed this drug to take it through a traditional FDA-compliant clinical development program. Now, interestingly, because a clinical observation had been made down in Virginia that the drug may, at least anecdotally, provide some benefit, we thought it was worth carrying forward through clinical trials. But frankly, neither Dr. Bennett nor we knew how the drug worked. It's more typical, at least in this day and age, to associate a drug with a particular target, a particular protein whose activity the drug will mediate in some fashion, and then carry it forward through animals and then into the clinic. We never knew, and we still don't know exactly, although our research is uncovering some very interesting findings, exactly how this Mirapex look-alike drug worked to protect neurons. But we knew that it did. So our approach is sort of twofold. We're starting in the middle and moving to the right to advance the drug clinically, while also moving backward to figure out if this drug really moves the dial in ALS, how is it doing it? And I'll share at least a little bit of some of our findings. Are there any chemists in the audience? Well, we do have some scientists here, so I'm not on completely safe ground. But we can all look at these images and process the similarities and differences. On the bottom, you see Mirapex, the drug that is approved for dopamine, or for Parkinson's disease. Now, our drug, which is in the middle, KNS 760704, you'll notice shares a very striking structural similarity. In fact, on the left side of the molecule, they are identical. For those who are interested in the technical difference, they are actually enantiomers, or different, it's the same drug, but where a particular group is tipped or angled at a slightly different angle than in the other enantiomer. That's my layman's simplification.